Hey everybody. Today I want to give you some updates on several announcements under our Manitoba Protection Plan. Before I do, I just wanted to say I know that many of us have had more chances to reflect in the last while perhaps than we do in a normal situation, and certainly I've been reflecting on the emotion that I know many of you are feeling right now, being in closer contact with some members of your family potentially and further away from other members of your family. I think the emotion around the uncertainty of this thing is probably one of the things that is adding to the stress levels for many Manitobans. And I understand that. I understand it because I come from a family that was impacted by a virus. The virus was polio, and in the 1930s my dad and my aunt were affected by that virus. My dad was confined, had to drop out of school, was confined to his bedroom for almost half a year, and my grandmother shared stories with me about those times, and they weren't easy times. She had to experience watching him learn how to walk again, and he was left with permanent disabilities and breathing and leg ailments. But he lived through it and survived it, and the memory of it is something that certainly my grandmother and others in our family would never have forgotten in their lifetimes. So I know right now, for many of you, these emotions are real too, and these stresses are real too. And it's the uncertainty, I think, of finding a cure for this thing, a vaccine that is hanging over the heads of all of us as we are dealing with the family challenges and other challenges that this pandemic has served up to us. So part of my theme, I guess, today is to say that I think a thank you is in order. People across this province have shown who they really are through this time, and they continue to do it. They stand up and they help one another. Just an example would be our Help Next Door MB website, where we've had thousands of people step up and offer to help others and are helping others who need that help. And so I just have to say thank you, because we're not only doing the things necessary to protect ourselves here, we're also doing the things necessary to protect the health and well-being of others. Je veux que chaque Manitoban sache à quel point je suis fier d'être intervenu, de travailler ensemble, d'aider ses voisins et de prendre toutes les précautions nécessaires pour s'entraider et surmonter ces temps incertains. 6,370 users so far on that website, over 170 cities, towns, and jurisdictions in Manitoba. So Manitobans are famous for stepping up and helping, but now you're proving it in an uncertain time, and I just wanted to say thank you. We are working on a plan currently to enhance this service, to ensure that even more of those Manitobans who have willing hands and are willing to assist have the opportunity to do that. In addition, I wanted to say again thank you to our frontline workers, emergency personnel, and I should mention also teachers and small business owners and all Manitobans for doing what they can to help provide services where they're able to continue to do that, and to help us also in flattening the curve. Nous aimerions féliciter tous les travailleurs de première ligne, les personnels d'urgence, les enseignants, les propriétaires de petites entreprises et tous les Manitobans de continuer à faire ce qu'ils peuvent pour aplanir le curve. In recent months, we have hired over 300 more nurses in our province. 2 weeks ago, we announced changes to allow for former nurses to return to work. And I said at the time, and I continue to believe, that nurses choose their profession because they are caring people, and they've demonstrated that. We have close to 50 nurses now who've returned to work, and serving the people of Manitoba is what they enjoy doing, and especially in these challenging times. I say specifically a thank you to them. Thank you for stepping up. Child care for critical workers has been and will remain a high priority for all of us. We made child care for our frontline health workers a priority some time ago in order to ensure that the frontline health services that we want to have available to all of us in this time of need are there. And that means we need the people there to do that work, and that means they need to be confident their children are being well looked after while they're doing that work. I should tell you that through the efforts, combined efforts of our departmental officials and personnel and partnership of assistance with the Chambers of Commerce, we've had over 1,600 child care needs addressed by just our frontline healthcare people alone. And we've expanded that service now to include all critical service workers in the province. And thus far, we have matched roughly 88% of all requests. So there's more to do, but we are getting a good way along there to helping people who need childcare get it. As of this week, we have moved now to an online process where critical service workers can look up available childcare at eswchildcare.ca, eswchildcare.ca, and contact centers or home-based providers directly. I want to thank both Minister Stephenson and Minister Friesen, our ministers in charge of these two departments of Health and Family Services, for their diligent efforts, and through them, of course, I think all Manitobans would want to thank all the staff and all the team that has helped to make these services available during this critical time and always. In terms of mental health supports, all of us recognize that there are many Manitobans who are living with anxiety and stress posed by this pandemic in particular, accentuated by this pandemic. And the health and well-being of Manitobans continues to be our top priority as we move forward through this uncertain time. All of us are dealing with worries of various kinds, worries about becoming ill ourselves, worries about the health of family members, of loved ones and friends, worries about being isolated from loved ones, and worries, as I said before, about not knowing when this will end. Our government is committed to helping Manitobans navigate these challenging times. These are unprecedented times, and I want Manitobans who are feeling stressed right now and who feel they need help to reach out. Understand, we'll get through this together, and understand too that you are not alone in these times. As part of our Manitoba Protection Plan, we've invested more than $4.5 million in launching a new online therapy program. And since our announcement just a couple of weeks ago, we have had over 800 Manitobans pre-register, and nearly 600 individuals are already actively receiving help and counseling, participating in the online therapy program, guided by professional therapists. I want to also say to Manitobans, you can, if you feel that you have the need for this help and support, you can sign up by visiting www.manitoba.ca/COVID-19, www.manitoba.ca/COVID-19. Support is available to you if you need it in the coming weeks. Please reach out if you need support during these uncertain times. And in closing, I just wanted to share with you a message that I bumped up against this week from the Center for Addiction and Mental Health, and I'll just share it with you. It struck me. As we continue to wake up apart, drink our coffee apart, work apart, care for our families apart, try to stay active apart, walk our dogs apart, teach our grandparents how to video chat apart, watch reruns of our favorite shows apart, forget what day it is apart, miss our friends apart, worry about our health and our jobs and our loved ones apart, stress about our finances apart, wonder if things will ever go back to normal apart, laugh apart, cry apart, and be apart. It is important to know that you aren't in this alone. So, remember, together we can beat this thing. Happy to take your questions.
Thank you. Time for questions from the media. Each reporter is allowed a question and a follow-up. Then we'll move on to the next reporter. Reporters, please introduce yourself before you ask your question. We begin with City News and Jonas.
Good morning, Mr. Premier. Thank you for your time this morning. Certainly seems to be an emotional morning for yourself as you speak about those that are dealing with maybe some mental health issues, some anxiety over this time. Why does this hit home so hard for you, aside from you spoke about your family with polio, but I understand this is something that is very important to you personally.
Well, it's important to me because I feel responsible, frankly. I feel responsible that, not for the pandemic, I didn't cause that, but for the reality that so many people are hurting right now, and that doesn't give any of us comfort. What we can get comfort from, I think, is doing our best to help. And so that's why I urge those who are feeling strong right now to help those who aren't, and those who are willing to do their part to do it, to step up and help those who need your help right now. It'll be remembered. This is a time for us to show the measure of who we really are.
And as a quick follow-up, as you work through all the issues our province is currently facing, this idea of the person and the person at home, I guess that is a driving keystone of everything you guys try to do?
It's a big part of it. As some Manitobans may know, I was, from the time Duff Roblin consolidated the rural schools, I moved off the farm and lived most of my time with my grandparents, so I feel a special affinity for the situation that is being faced by seniors right now. They see the reports of deaths and illness in seniors' homes in other parts of the country, and it scares them, and they're worried about that. They know the sense of isolation that they're experiencing right now. They'd rather have a hug than a Skype. So we all feel that, I think. And I think it's important that people step up. And in particular, I think with our seniors, our vulnerable people, people who are living with a disability and people who are aged and infirm. It's very, very important that Manitobans remember them in their thoughts and in their actions whenever they can possibly help.
Next up, from the Free Press, Larry.
Larry Klisher, Winnipeg Free Press. Mr. Premier, the Prime Minister said yesterday that massive rapid testing is needed before the economy is really able to reopen. Manitoba seems to be doing fewer tests lately than it has been. I'm wondering what resources is the government prepared to make in the expansion of testing in Manitoba?
Yeah, it's a fair point, and I think the Prime Minister makes a good point, and Premier Kenney has also looked at adding to the testing capabilities in the province of Alberta. To this point in time, of course, Larry, we've been focused naturally on doing all the preventative testing and diagnosis that we can to fuel our capacity to assist those who are suffering from COVID directly. And we've been, I think, quite successful in doing so. To be frank, though, the opening of our economy is vital, and so this is an issue of importance and discussion that we're undertaking right now because we know that through increased testing there is an increased possibility that we'll be able to build confidence not only in the general populace but in the health officials whose guidance we must listen to, that we are not opening the door to resurgence in COVID infections in our province. And so that testing is an important aspect of what you're talking about.
As a follow-up, can you assure Manitobans that money will not be an issue in terms of an expansion of testing in Manitoba?
Well, I've just addressed the issue of the need for further testing, so I think I've answered your question.
Thank you. From Global, Brittany.
Good morning, Mr. Premier. I'm wondering if you've heard back from any of the public service unions that you spoke with earlier this week about the reduced work week, because MGU says that based on the information they had with no description of who's essential and who's not, they felt they couldn't support the move.
Right. Well, that dialogue continues, and I think it's important it does, because what we're trying to do is get the cooperation of our public sector unions in not having to do layoffs. That's why I'm talking to the Deputy Prime Minister. It looks like it'll be in the next 24 hours, about this specific issue. All across the country, people in the private sector and in some Crown corporations are using work share programs to help people stay at work part-time while they're able to receive EI benefits. And I would clarify again, this isn't about asking Ottawa for money. This is about asking Ottawa to allow us to use our own money in a creative way so we don't have to do layoffs. The employment insurance program isn't funded by Ottawa, it's funded by employers and employees. Manitoba paid in over $2 billion into that program over the last 10 years, and we're simply wanting to use it in a creative way so we don't have to lay people off. So it's a smart program. It's being used all across the country in the private sector, and it needs to be available, I think, to the public sector as well, so that we can keep people working part-time for a time on a temporary basis while they're able to access additional funds from the employment insurance program.
Thank you. My follow-up would be, you said you're speaking with the Deputy Prime Minister more about this. How long will you give the unions to get on board with this before there might have to be outright layoffs that are handed down?
Well, frankly, it's a bit in the federal government's playbook right now. They have to decide if they want to give us the latitude to use this for core government. We have the latitude to use it in the Crown corporations now, and Crown corporations leadership has already responded with the development of some plans. There's more planning going on right now to determine which employees are not essential at this point in time. So that dialogue is going on. But frankly, if the unions and the federal government want to force us to do layoffs, we'll have to do some layoffs. There's no doubt about it. The reality is that civil servants and public servants exist to serve the public, and right now many of them are not required to serve the public for obvious reasons given this pandemic. So we'd like to keep as many people as possible working on a part-time basis. We think that's a smart approach. We think that's the approach most union members, certainly. We've got lots of perspective from public servants through our MLAs and their feedback who believe this makes good sense, and they prefer to see it this way as opposed to us being forced to do layoffs. So we'd prefer that too.
The Brandon Sun, Drew.
Thank you. This is Drew May from the Brandon Sun. Mr. Premier, we're hearing reports here in Brandon that not all workers in personal care homes have access to personal protective equipment. Just wondering if you have any sense of when these workers will be getting access to that equipment?
Well, I think Dr. Roussen's doing a full report here in about an hour and a half, so I'm sure he'll have up-to-date information. I can only say, Drew, that every effort has been made and continues to be made. Not only were we the first province to sign on to the federal coordinated provincial procurement exercise, but we have launched additional procurement initiatives in tandem with those orders being placed so that we would be in a position where we had as much as was available protective equipment and gear for our frontline workers. So every effort's being made. Dr. Roussen will be able, I think, to give you some additional update on that.
Thank you.
You bet.
From CJOB, Diana.
Good morning, Mr. Premier. Diana from 680 CJOB. With respect to the pandemic, when it comes to our seniors, our more vulnerable people, has there been a really concerted effort to check and inspect personal care homes around the province, whether they're public or private? Are they being inspected to make sure they've got the proper staffing levels and the PPE they need at this time?
Well, Diana, without doing a victory cry, and I'm not going to do that, I would say there is no doubt that the inspection people have done a commendable job. There's no doubt either that when you look around the country and you see the sadness of events in other parts of the country in respect to personal care homes, it should give Manitobans a sense of personal pride and confidence in the way in which our personal care homes have been managed, and they should also be very thankful about the staff there. In other parts of the country, such has not been the case. But certainly here I would just put a shout out to those who work in the care homes there, the staff, and also our inspectors and the people who are responsible for making sure that compliance is done there. Dr. Roussen has speculated on some additional endeavors as well, and I know he'd want to give you more detail on that in a few minutes' time.
And just as a follow-up, same sort of question, is the same level of inspection happening at group homes and places where more vulnerable people are as well, not just seniors?
Yeah, again, our regimens or our protocols for inspections are being followed. They are continuously important, not just during pandemics, but on an ongoing basis. And of course, the heightened situation in respect of risk right now raises the awareness of how important those are.
Next, the Winnipeg Sun.
Good morning, Premier. This is Josh Aldridge with the Winnipeg Sun. In your opening, you talked about daycare centers. You also talked about mental health concerns. Last night, you guys approved $1 billion in spending and borrowing another $5 billion. Is there any chance that there is going to be, or how much of a chance is there going to be that there's going to be direct financial assistance for individuals and businesses, which would address keeping doors open on daycares and other businesses, and would also alleviate a lot of the mental health concerns when it comes to anxiety and stress about simple things like making rent or keeping the doors open on a business? Is there much chance in that spending that we are going to see some direct financial assistance?
Yeah, there's a great chance. What I would emphasize here is that there's a tremendous importance in the federal and provincial governments having coordinated strategies here. I've emphasized this in the past. I'll emphasize it again. We can't possibly design a plan that effectively fills in the cracks when we don't understand where the cracks lie. And so as recently as yesterday, the federal employment minister announced other changes to the federal plan. More recently, this morning, the Prime Minister announced other changes to the federal plan. Each time that happens, that creates uncertainty as to where the cracks may lie. We want to have supports for our small business enterprises in this province that work. That's why we're supporting the biggest piece of the federal government plan, which is the wage subsidy program, and assisting already hundreds of Manitoba businesses. I expect that program to be up and running before next week, and it will be assisting potentially tens of thousands of Manitoba businesses in accessing wage supports. But if we can get clarity from the federal government on a couple of issues, that would help tremendously. Right now, for example, the plan is supposed to end in June. We don't think the pandemic's effects will end in June. So I and other premiers have been urging the federal government to announce immediately that the plan will continue through the summer. That would help tremendously. It would actually encourage more businesses to get into the lineup to get support. Secondly, the federal government has said they're going to be issuing checks, but only after about a 6 to 8 week period. That's too slow. We need to get the money in the hands of our small business people sooner. The loan program and the wage subsidy program are good programs, and I thank the federal government for their initiatives in creating them and their willingness to listen in designing them. But it is at the point now where several provinces are saying the same thing I'm saying. They'd like to be able to help those who are falling through the cracks on these programs, but they need to know what the federal government timeframes are, what their application criteria are. Right now, there's no application form. We need to get going on this thing because small businesses are hurting right now and they need help right now, and we're ready to help and we're going to help. But we need to do it in a coordinated, logical, thoughtful, intelligent way so it works to keep people at work and to get our small businesses back hiring people so they can get to work too.
And for my follow-up, not to belabor the point, but the next month is coming right around the corner, May's coming right around the corner. Do you have any kind of a time frame when we might see some of these clarifications that would allow for these programs to be put in place, as it will take time for them to even come into effect as well? Any kind of timeline you guys are working on?
Well, we've had meetings over the past few days, and we're having more meetings even today to get guidance and assistance from business groups that have, been getting, as we have, regular contact and input from small businesses on where they think we can design the program most appropriately to help those businesses most profoundly affected and needing assistance. That's how we're going to be designing our programs. But again, I would emphasize, we don't want to be creating a situation where there's unnecessary confusion, where there's duplication, because that will result in great expense and waste for small businesses, and in fact will discourage many small businesses who don't have a plethora of highly paid accountants and lawyers to work for them all the time. Many small businesses are very much needing to understand what we are wanting to understand for them, which is how can these programs best complement one another, not duplicate each other.
Next up, CBC Radio Canada.
Bonjour, M. Pallister, Foucault from Radio Canada. President Trump in America hinted that he might want to reopen the Canadian border. What are your thoughts on that, and how concerned are you?
Well, I'm a proponent of free trade and thin borders whenever possible because Manitoba is a trading province. That's how we create most of our jobs in Manitoba. So for me, any time that President Trump muses about building a wall, I certainly hope he isn't talking about between Canada and the United States, or anywhere else for that matter. So him musing on opening the border, that's nice. I just hope he doesn't muse about closing it tomorrow.
And on an unrelated topic, there are defense lawyers who represent young people who are involved in Manitoba's criminal justice system, and they're raising the alarm bells about youth who are being held in solitary confinement while they wait to see if they're eligible for bail. So does that situation concern you? And if so, what can your government can do to assure better conditions to these young people?
Well, if they're not in solitary confinement and they're placed in some other location where they're exposed to COVID, I would say it would be better to be in solitary confinement, but I don't know the details of the specific situation that you're raising. So beyond that, I can only say that we're concerned obviously about the safety, health, and well-being of all Manitobans, whether they are incarcerated or not, and whether in actual fact we have already taken steps to ensure that we have better protections for those who work in our provincial correctional facilities. And more may need to be done, but we will continue. We've been fortunate so far not to have cases emanate from our correctional centres elsewhere. That hasn't been the case.
Next, CBC Manitoba.
Barbecues at CBC Manitoba. How much money does the province expect to save from the clawbacks to the service providers that Treasury Board Secretariat has requested from all government departments?
What you're referring to is a CBC I-Team investigation that referenced a letter which was sent out to service providers that asked if there were savings, potential ideas for savings. That's a normal course of government action in non-pandemic times, and I'm not sure of the validity of the story.
Well, it was my story. It was an I-Team, and I saw the letter, and with respect, Mr. Premier, you're wrong. It was directly referencing the pandemic. I'll ask you another question.
Sure.
What do you think of the criticism that you spent money on Morneau Chappelle, money on North Forge, money on 247 In Touch, that haven't provided direct subsidies to small businesses like the CFIB has requested?
Well, I would say we've made hundreds of millions of dollars available in direct assistance already. We just announced, for example, yesterday an $88 million reduction in the insurance premiums that Manitobans would pay on their home insurance and on their commercial insurance. That is a direct assist in and of itself. So your preamble is false, and I can't answer the question as a consequence of that.
Up next, the Canadian Press. Let's move on. CTV.
Hi, Jeff Keel, CTV. Mr. Premier, with the announcement today by the Prime Minister expanding the loan program and also talking about possible 3-month relief for commercial rent, does that help clarify for you what measures you might take? Because other provinces have simply topped up and given grants. Does that help the clarification?
Yeah, well, of course, once we get the detail, I'll have a call with the Prime Minister later today, and we'll see if we can get more detail. But the fact remains, this is a new announcement that would require some cooperative partnership between us and the federal government that just came today. And again, it makes the point, I think, that we need to ensure that we have ongoing communication, but that had we introduced a program 3 days ago, we would have just had to totally revamp the program as a consequence of the federal announcement by the Prime Minister earlier this morning. We're preparing and we are researching in conjunction and in consultation with affected people in Manitoba and their representatives, whether in business or labor, how to develop our plans so they complement other programs effectively, don't compete with them. This isn't about getting credit for having a program. It's about having programs that work effectively. And for example, as I said before, where business subsidy programs are confusing, smaller businesses may not even apply as a result. We want the uptake on these applications to be big. We want Manitobans who need help to get that help, and so we'll continue to work with the federal government and other partners to make sure that our programs are intelligently designed, well designed, and get the money to the right people. We've always been open to helping those who are falling through the cracks. We just have to know, with the help of the federal government, where those cracks lie.
And my follow-up is something you referenced yesterday. You mentioned a number of industries, just the golf industry. Do you anticipate golf courses will be able to open, I guess not on time, but like sooner rather than later, maybe compared to some other activities?
Well, I know that other provinces actually have already unveiled some plans. I hope we can, but I know that public safety is our first concern. And so whether it's golf courses or any other business enterprise, we're going to have protocols that are clear and understood, and we're going to have to be able to demonstrate that the people who use these facilities, services, whatever it may be, are going to be safe using them. Also, the people who work there are going to have to be secure and confident, knowing that they will not become, a COVID patient as a consequence of what we do. So we want to get the economy back running, but we also want to make sure that we're following all the necessary procedures that we can to reduce the likelihood of further COVID infections in the province of Manitoba.
Let's check back in one more time with the Canadian Press. And Steve, are you there?
Hi, sorry. Having technical trouble here. Sorry about that. It's Steve Lammer from the Canadian Press Premier. Regarding the reduced work week idea for the civil servants, I understand the example given to the unions was the voluntary reduced work week program. Is this program voluntary, and if so, what percentage uptake do you need?
Well, we're in the midst of the planning and the discussions right now, Steve. I'll only say this: there's a well-established work share program that is being used, has been used for some time. This is not that novel an idea, I have to say. I mean, I'm being criticized for trying to come up with according to one newspaper today, some kind of a harebrained scheme or something. If it's that bad an idea, why are private sector companies like the Winnipeg Free Press using it? Why is it all across the country being a program that is so popular with WestJet and New Flyer and so on and so forth? It's a work share program. The idea is you don't have to lay people off if you can reduce the work week and allow people to continue to work while accessing some supports from the employment insurance program, which employers and employees in Manitoba have paid into for years and not collected much on. We're probably the bottom-ranked province when it comes to claiming on EI. So this is a time when we need to collect on EI because there isn't work for everybody. It's a short-term measure to help keep people at work on a reduced basis and use the EI program to supplement their incomes so that people can continue to get more support than would be the case if you had to lay them off. I'd prefer not to lay people off. Our government has not laid people off. We've allowed, yes, we've reduced the size of the public sector by allowing people to retire and not hiring two people back to replace one. But the fact of the matter is, we would like to continue to keep people at work as much as possible. So that's the nature. The nature of the discussion with the federal government is to allow the extension of what is being done in the private sector, what is being done in crown corporations across the country, what is being done in some nonprofits, cultural organizations, sports organizations, to be done within the government of Manitoba. It's not a hard concept to understand, and I think most union members would prefer, rather than having to be laid off, to continue to do part-time work for a short time, and then when the pandemic's over, come back and work again.
And my follow-up would be, again, is it going to be completely a voluntary program? And if so, ballpark figure, what percentage of non-essential public sector workers do you need to uptake on this?
Well, it's not a question of need, it's a question of analysis, and that analysis, as I said, Steve's underway. I can give you a ballpark, though. I think it's pretty clear that we're not going to ask anybody to take a reduced work week in the healthcare sector, so that eliminates close to half of our people, right? We've got teachers who are working full-time. We've got people in various sectors of child and family services that are not going to have a reduced work week. But in about a quarter of, what we estimate, about a quarter of the positions, there's reduced demand just simply because people are not needing the services. The government offices are not able to provide the service anyway in some cases, or in other cases there's no public demand because people are staying home. So for that reason, just common sense that when people are unemployed, we should be using a reduced work week. That's what would happen in the private sector. That's what's happening all across the country in other sectors. It needs to happen here too. And our hope would be that a shared work week would be supported by the union leadership. We know it's supported by many of the union members already. Just to wind it up then, I understand that Steve was the last question there. I just wanted to remind everybody to continue. Don't forget, don't relax on this issue about hand hygiene, about personal hand hygiene. That really matters. Take those measures you need to make to keep yourself safe, keep yourself away from COVID, and help others stay away from COVID too. Remember when sneezing to cover your mouth and nose with a tissue. Remember that you can also, if you have to, use your sleeve to protect yourself. Don't sneeze moistly. Try to make sure that you protect others around you. Wash your hands. Use alcohol-based hand cleaners if you can get those. Avoid close contact. Stay at least 2 meters away from anyone, not just those showing symptoms of a respiratory illness, but anyone. And certainly with children and adolescents, make sure that you're watching them to not allow them to share food. Don't share drinks. Make sure that you keep them safe too. Stay safe. Talk to you soon.